Preventing Human Trafficking Training for Nebraska Foster Parents. Thank you for attending. My name is Ivy Bloom. I will be your narrator today. I am a program specialist with Children and Family Services. I am the lead for our Preventing Sex Trafficking program and our Missing Youth program. Today our objectives are having a broad understanding of the definition and indicators of human trafficking, what the high risk factors are for human trafficking, how to prevent human trafficking, and the resources available to help. We first want to recognize that this is a survivor-led movement. I would like you to listen to some video from T. Ortez Walker Pettigrew. She is a survivor of sex trafficking, and the things that she has to say are very important. We want to realize that T is a survivor of sex trafficking. She has a lot of perspectives on the prevention of sex trafficking for youth in the child welfare system. Her main points in the video are: foster children accept and normalize being used for financial gain. Foster care normalizes that other people will control our circumstances and come in and out of our lives. As foster youth, we lack opportunities to gain meaningful relationships and positive attachments. And traffickers have no fear of punishment due to the lack of attention paid to young people who are missing. This is very important to realize because our youth who do go missing from care are a very vulnerable population to becoming involved with instances of sex trafficking and labor trafficking due to their vulnerabilities. I will talk a little bit about the Preventing Sex Trafficking and Strengthening Families Act, which is Public Law 113183. This public law was signed into law by President Obama September 29th of 2014. It takes important steps forward in protecting and preventing children and youth in foster care from becoming victims of sex trafficking, and it allows us to make many important improvements to the child welfare system that will help improve outcomes for children and youth in foster care. It also recognizes the importance of making every effort to normalize the lives of youth in out-of-home care and to empower the youth's caregiver to use reasonable and prudent parent standards, which allows youth to participate in extracurricular, enrichment, cultural, social, and faith-based activities. This law helps the child welfare system to identify and assist children who are victims or at risk of sex trafficking or labor trafficking. This law also allows the child welfare system to respond to missing youth from foster care. It also allows for normalcy in foster care, making sure foster parents and caregivers can make parent-like decisions about things such as extracurricular, social, and cultural, and faith activities. Nebraska also passed LB 746, which is the Nebraska Strengthening Families Act. This brought Nebraska into compliance with the federal law through the implementation of LB 746. Human trafficking is a form of modern-day slavery. We use the federal definitions for sex trafficking and labor trafficking. Sex trafficking is the recruiting, harboring, transporting, providing, or obtaining a person for a commercial sex act that is induced by force, fraud, or coercion. When the victim is under 18, no force, fraud, or coercion is necessary. Labor trafficking is recruiting, harboring, transporting, providing, or obtaining a person for labor or services through the use of force, fraud, or coercion for the purpose of subjection to involuntary servitude, peonage, debt bondage, or slavery. Human trafficking is a market-driven criminal industry based on supply and demand and is fueled by a demand for cheap labor, services, and for commercial sex. Labor trafficking and sex trafficking of U.S. citizens and foreign nationals persist and thrive. Why? There is a low risk. Traffickers perceive there to be little risk that affect these criminal operations and believe the high profit margin to be worth the risk of detection. Factors that add to the low risk include lack of training for government staff and law enforcement, low community awareness, ineffective laws, social blaming of victims, and lack of resources for survivors or victims to recover. There are also high profits. When individuals are willing to buy commercial sex, They create a market and make it profitable for traffickers to sexually exploit children and adults. When consumers are willing to buy goods and services from industries that rely on forced labor, they create a profit incentive for labor traffickers to maximize revenue with minimal production costs. Left unchecked, human trafficking will continue to flourish in environments where traffickers can reap substantial monetary gains with relatively low risk of getting caught or losing profits. 20 million people worldwide are affected by trafficking each year. 1 out of 1,000 people are trapped in jobs into which they were coerced or deceived. 17,500 people are trafficked into the U.S. every year. Human trafficking is the second fastest growing criminal industry, just behind drug trafficking. And human trafficking is a $150 billion industry worldwide. Human trafficking affects the most vulnerable populations. We know that these vulnerable populations include adults and youth with a history with the child welfare system, youth of color, refugee and migrant children, LGBTQ+, people who are affected by homelessness and poverty, and youth that are missing from care. Missing and homeless youth are vulnerable to trafficking. These youth lack a strong supportive network, and when they go missing to unfamiliar environments, these youth are particularly at risk of trafficking. Missing youth are often approached by traffickers at transportation hubs, shelters, or other public places. Out of homeless youth, 30 to 50% are sex trafficked with no gender bias. Up to 40% of homeless youth identify as LGBTQ+. Of those identified, 46% went missing because of family rejection and were 3 to 7 times more likely to engage in survival sex to meet basic needs. There are 3 common paths that can take youth from the foster care system to being victims of sexual exploitation. The first path is that they go missing and end up homeless and are lured by traffickers to become victims. The second is they age out of the system, end up homeless, and become victims. The third is that they are lured away by the traffickers and go directly into exploitation, therefore avoiding homelessness. Please note, the joining force of all of these are that of homelessness. The vast majority of youth do not become homeless by choice. Many different factors contribute to youth homelessness. The majority of homeless youth have either gone missing from placement, been kicked out of unstable home environments, been abandoned by their families or caregivers, or they're involved with foster care, juvenile justice, or mental health systems. They may have a history of residential instability and disconnection. The Department of Health and Human Services and the Division of Children and Family Services is currently experiencing a cultural change. We're no longer using the terminology to refer to our youth as runaways or being on run. We do not want to place negative labels on our foster youth by calling them these terms. We'd like to refer to them as being missing from care or unable to be located. Youth in the foster care system already have to deal with negative labels just by being in the system. So it will help how we talk to our kids and how we talk about our kids, and making sure that we are always being positive when referring to our youth. Our youth do have reasons that they go missing from care. And if we can get to the root core of why they feel like they're possibly not safe in their placement as the reason for going missing from care, it's our job as adults to make sure that they feel cared about, that they feel loved about, and feel safe in their placements so we can keep them safe. As we know that youth in the foster care system are one of the most vulnerable populations to being trafficked, either sex trafficked or labor trafficked. It's very important to be able to recognize indicators and red flags of sex trafficking. Some things that you may be able to recognize as a foster parent would be chronic missing or homeless youth, excess amounts of cash in your foster youth's possession that they may not be able to explain its source, having hotel keys and key cards, knowing that they are going out of the home and lying about their age or possessing a false ID. When the youth has inconsistencies when describing and recounting events as you're asking questions when they have come home late. If the youth is unable or unwilling to give local address or information about parents or guardians. If they have a presence or a fear of another person. If possibly they're dating an older male or have a boyfriend who seems controlling. If youth have a high number of reported sexual partners at a young age. If you're looking at their social networking sites and noticing sexually explicit profiles or pictures. If your foster youth has injuries or signs of physical abuse that, again, they may be reluctant to explain. If they have an inability or fear of social interaction. If their demeanor is exhibiting fear, anxiety, depression, submissiveness, tenseness, or nervousness. If your foster youth has repeated absences from school. Also, sex trafficking victims may not consider themselves victims. If you notice a loyalty to or have positive feelings toward someone who may have exploited them, like a trafficker or a pimp. And if you're noticing that the youth has prepaid cell phones that you don't know how they came into their possession. Youth victims of sex trafficking may look like the children you see every day. Youth engaged in commercial sex are victims of trafficking. The presence of the indicators noted does not definitively mean the youth is a trafficking victim. These indicators serve as clues to be assessed with the broader context of all information presented. Youth rarely disclose that they have been sexually exploited. Youth often do not realize they are victims of trafficking. Many view their exploiter as a boyfriend, and the process of breaking that trauma bond is time and resource intensive. Youth who are trafficked may still be under the control of a trafficker even after they are returned to foster care, a family home, or are rescued from that situation. Youth who are trafficked may have a history of repeated sexual exploitation or being missing from care. Trafficked youth often suffer from depression, hostility, stress, anxiety, post-traumatic stress disorder, and fear of authority, as well as fear of those who victimize them. Outward symptoms of depression, anxiety, or hostility may present as difficult behavior or resistance to assistance. Other physical symptoms, such as sexually transmitted diseases, may mask the fact that they have been exploited. It's also important to know what the indicators and red flags are for labor trafficking. Labor traffickers can include recruiters, contractors, employers, and others that use violence, threats, lies, debt bondage, or other forms of coercion to force people to work against their will in many different industries. Labor traffickers often make false promises of a high-paying job or exciting education or travel opportunities to lure people into horrendous working conditions. Traffickers also exert physical or psychological control, including physical abuse, confiscation of passports or money, and the victim believes that they have no other choice but to continue working for that employer. U.S. citizens, foreign nationals, women, men, children, and LGBTQ individuals can be victims of labor trafficking. Vulnerable populations are frequently targeted by traffickers. Immigration status, recruitment debt, isolation, poverty, and a lack of strong labor protections are just some of the vulnerabilities that can lead to labor trafficking. Labor trafficking occurs in numerous industries in the U.S. and globally. In the United States, common types of labor trafficking include people forced to work in homes or as domestic servants, farm workers coerced through violence as they harvest crops, or factory workers held in inhumane conditions. Labor trafficking has also been reported in door-to-door sales crews, restaurants, construction work, carnivals, and even health and beauty services. It's important as a foster parent to know about ACEs, which are adverse childhood experiences. These are traumatic experiences that occur to an individual in childhood and adolescence. Depending on the different adverse childhood experiences that youth had while growing up can reflect in behaviors, emotions that can affect the way the youth responds to different situations. Depending on the different adverse childhood experiences the youth had, can really affect the way their brain has developed. We know that the developing brain begins in the amygdala. The amygdala stores memories of an adverse event. The amygdala is a very strong area of our brain. It works with the hippocampus to regulate memory and emotions. These two areas of the brain are strong compared to the prefrontal cortex, which allows us to think, have logic, and to evaluate what is going on. When youth in care experience triggers from an adverse childhood experience, the amygdala turns on fight, flight, or freeze. And sometimes that area of the brain is so strong, it's very hard for youth in foster care who have had a lot of trauma to get to the area of their brain in the prefrontal cortex to have logic or figure out what to do in a certain situation when they're feeling high stress. So it's very important to know how the brain works, what those past triggers are of the foster youth that you're caring for. So you as a caretaker can help alleviate the triggers to prevent the fight, flight, or freeze, and possibly being able to keep our youth safe in your home so they don't go missing from care to become another person who is vulnerable to sex trafficking or labor trafficking. Many times we see the push and pull in trafficking situations. By push, we mean youth that have a history of abuse, a history of feeling marginalized, questions about sexual orientation, youth going missing from care, and youth coming from poverty situations, tough economic situations. By pull, we mean a trafficker promising relationships, promising family, a home, promising to provide income, and promise the youth that they will belong to a group. Traffickers target those who have low self-esteem, an unstable home life, minimal social support, and those that have been abused, neglected, or exploited already. Youth can be recruited from group homes, on the internet, social networking sites, public places like shopping malls and schools. When youth experience trauma such as poverty, homelessness, or sexual abuse, they become vulnerable for recruitment. Traffickers use elements of power and control to recruit, such as emotional violence, isolation, physical violence, economic dependence, and sexual violence. Traffickers not only use power and control, but they also pretend to be a boyfriend or significant other, using feigned affection and manipulation to elicit commercial sex or services from the victim. Many times this works because the youth has not felt cared about or loved. Our youth of color are especially vulnerable to trafficking. We also see other factors for vulnerable youth, such as cognitive or developmental delay, truancy, or being bullied at school, and alcohol and substance use. 50 to 98 of the commercial sexual exploitation of children across the nation involve children with a history of child welfare involvement. This not only affects children in the child welfare system, but also youth who have juvenile justice involvement. 70 to 90% of youth have a history of child sexual or physical abuse, neglect, or trauma. There are 4 commonalities in the backgrounds of victims of traffickers who are also in the system. These youth were victims of sexual abuse as a child. 65 to 95% of trafficked youth were sexually assaulted as children, and those that are sexually abused as children by a family or friend, the child learns to associate love with pain and sexual abuse so the victim can get involved with abusive, dangerous relationships because that is what they know. Also, neglect and abandonment. Youth who are removed from their home and placed in foster care can lead to a youth feeling abandoned. The effects of this can lead them to trafficking. Much like youth who experience sexual abuse, the youth may have difficulty trusting others and feeling insecure, unloved, or unwanted. They also fear rejection, and they have a strong need to please others. Youth that are missing from care or throwaway youth. The National Center for Missing and Exploited Children found that 68% of missing children reported to them that they were also likely child sex trafficking victims were in the care of child welfare when they went missing. Also, youth and young adults that are aging out of the system and that are homeless. We know that nationally, 26,000 youth age out of the system each year, and that 40% of those youth aged out, they end up homeless. That's why it's so important that we work with our youth on skills to be able to live independently and also have a strong support social network once leaving care from the system. Foster parents have a unique opportunity to establish and build a rapport with youth that will help create normalcy in the family by creating positive attachments and meaningful relationships, and working with youth to teach problem-solving skills and how to reconcile after disagreements. Certain situations can be hard when fostering, but don't give up. Be positive. It is so important to work with our youth to keep them safe and in a stable living environment. By listening, understanding, caring for and about our youth will help them feel love and hope. Foster parents must be able to recognize indicators of sex trafficking victimization and labor trafficking situations and learn to be non-judgmental, have empathy, and be trauma-informed. It is so important as a foster parent to be able to listen, believe, and respect the youth you are fostering. As you're listening and engaging with your foster youth, be patient. People who have experienced trauma may not share everything all at once. While you talk and engage with your foster youth, believe what they are saying. Start by believing. Build trust with your foster youth first. First, just focusing on the facts. When a youth has trust issues, they may not be completely truthful at first. So work with them and know that their disclosure is a big first step and they are trusting you. And respect. Be the role model for your foster youth. Show what respect looks like. They will mirror that. Foster children need and long for healthy families who will parent and love them unconditionally. As a foster parent, it's very important to stay engaged and ask questions. Foster parents are an important resource in the fight against human trafficking. Youth in foster care are easy targets for traffickers and are the most susceptible to the manipulation and false promises that traffickers use to secure their trust and dependency. Foster youth may have fractured safety nets and have few alternatives. The focus must be changed regarding youth who go missing from care as being a juvenile delinquency issue to a child protection issue. Foster parents must report youth in their care who have gone missing to their local law enforcement agency, who will then enter the missing youth information into the National Crime Information Center. The following information should be given to law enforcement if a youth in your care goes missing: the youth's full name, their date of birth, social security number, gender, height and weight, race and ethnicity, their physical description that will include if they have tattoos, piercing, body markings, what the youth was last wearing, the date, time, and location where the youth was last seen, names of the last person or people who have seen the youth, information about the youth's general health, any medical conditions or concerns, and current necessary medication use, recent changes in the youth's behavior, information on if the youth is at risk of possible sex trafficking, if they've had a past history, association with certain people, or suspected parental involvement. Information regarding any individuals who have shown unusual attention or interest in the youth, information about any social media accounts the youth may have, and the youth's phone number. The information you see on the screen is about Gaggle. Their safety representatives often discover social networks or websites and apps that pose potential risks to students. This list is updated regularly. You can go to this site and it will show you information about different sites and what they mean if you see certain things on your foster youth's phone. The example we're using is Backpage.com, which is a classified advertising website launched in 2004, notorious for allowing ads that sell children for sex. Talking about protective factors. There are 6 proven protective factors: nurturing and attachment, knowledge of parenting and child development, parental resilience, social connections, concrete supports for parents, and social and emotional competence of children. Again, be a role model for your foster youth. Understand the foster youth's normalcy. Support the youth in their decisions, negative and positive. Please know that although the foster youth you are helping may have had some traumatic events growing up, attachment can be rebuilt. And as a foster parent, making your foster child a member of your own family is so important. And treating them as if you would treat your own child. And really being able to put the reasonable parent prudent standards to work. Encourage your youth, your child, to follow their dreams. Nebraska state law requires any person who suspects that a child has been physically or sexually abused or neglected to report it promptly to the Nebraska Department of Health and Human Services, Nebraska Adult and Child Abuse and Neglect Hotline. This includes suspicious activities that may be related to sex or labor trafficking. When a call is received at the hotline reported suspected sex or labor trafficking situations, the hotline will accept an intake and assign it as a P1 response, which means that we must make contact within 24 hours with the family. The hotline will also contact law enforcement, do a safety and risk assessment. They will also contact the local child advocacy center and contact the county attorney. The Nebraska Adult and Child Abuse and Neglect Hotline received reports of sex trafficking in 2015 and 2016. There were 31 reports for each year. This data shows the different counties the reports came in. In Nebraska, the counties of Buffalo, Brown, Lincoln, Wayne, and Seward each had 1 sex trafficking report. Sarpy and Hall counties had 2 reports of sex trafficking. Dodge County had 3 reports of sex trafficking, with 2 of those reports being related. Douglas County had 9 reports of sex trafficking, and Lancaster County had 10 reports. Nebraska had higher volumes of sex trafficking reports during the month of October, August, September, and November. The rest of the year remained at an average of 1 sex trafficking report per month, with the exception of December. Out of the 31 sex trafficking intakes reported, the alleged victims were 28 were youth involved, 3 were adult involved, 29 of the victims were female, 2 were male. The source, while reporting to the hotline is confidential, we do keep a small amount of data about the reporters. We do know that medical professionals in 2015 were the most common reporters of sex trafficking, followed by social service workers, public and private, law enforcement personnel, school personnel, family, and anonymous persons. In 2016, sex trafficking reporting to the hotline, we again saw 31 reports. The Nebraska counties that saw reports of sex trafficking were Boone, Buffalo, Dawson, Dixon, Fillmore, Platte, Scottsbluff, with 1 report of sex trafficking each. Lancaster and Washington counties had 2 reports. Sarpy County had 6 reports, and Douglas County had 12 reports of sex trafficking. The months reported, September and November had the highest reports for each month. January, February, August, and October had 3 reports to the hotline. March, April, May, June, and July 2 reports, and December 1 report. Of the alleged victims, all were youth involved, 4 being male, 27 being female, 1 with no victim identified. Of the reports received, 11 of the alleged victims were either former or current Nebraska state wards. Information received that 14 of the alleged victims were missing from care. 8 were current Nebraska state wards, 2 were youth missing from other states, and 5 were youth missing from Nebraska communities that were reported missing by their parents. Of the people who called to report, public and private social services personnel were our highest reporters, followed by law enforcement personnel, medical personnel, probation, educational personnel, anonymous persons, family member, a friend or a neighbor, and a victim did report as well. Wanting to share some data with our youth missing from care, this is a point-in-time report, meaning that a report is ran on a certain day, and this is what it looks like during that time. So this point-in-time report is from August 14th of this year, 2017. On that day, the Division of Children and Family Services had 43 missing youth from care. We had 23 girls missing and 20 boys missing. They ranged from ages of 13 to 18. And if you notice, the numbers get higher as the youth get older. 17 youth that are 17 years old and 12 youth that are 18 years old are our highest number aged youth missing. The race and ethnicity show that we have 7 Native American youth missing, 13 Black or African American youth missing, 6 Hispanic, 1 multiracial, 15 Caucasian, and 1 Asian. Looking at the number of placements, on 8/14 of 2017, we had 8 youth with 0 to 1 placement, 2 youth with 2 placements, 9 youth with 3 placements, 3 youth with 4 placements, 2 youth that have had 5 placements, 2 youth with 6 placements, 3 youth with 7 placements, 4 youth that have had 8 placements, 1 youth with 9 placement. We have 9 youth that have had 10 or more placements. This is how important foster parents are. If you can maintain a foster youth in your home and allow them to stay and have a healthy, thriving relationship with you and your family, you will alleviate the amount of placements that our foster youth experience. Also looking at where our youth go missing from. We had 2 that went missing from a parent or caretaker, 2 from independent living situations, 1 from a detention facility, 2 from kinship foster placements, 4 from relative foster home placements, 2 from emergency shelter, 1 with no prior placement. That means the family has come into the child welfare system, and we have not yet laid eyes on that child to make sure that they are safe. 1 was missing from an adoptive home, 12 missing from group home, 14 youth missing from agency-supported foster care. We also look at the number of days that our youth have been missing from care. We have 9 youth that have been missing for 5 to 7 days, 3 youth missing from 8 to 14 days, 6 youth missing from 15 days to 28 days, 2 youth missing for over a month, 6 youth missing for over 2 months, 7 youth missing for over 3 months, 5 youth that have been missing over 4 months, 3 youth missing for over 210 days, and 2 youth missing over a year. When you think about how long some of these youth have been missing, what comes to your mind? How they are surviving? Where are they sleeping? Where are they living? Who's supporting them? How are they getting healthy food to eat? It's always worrisome when we have youth that are missing from care for any length of time. Also looking at where our youth at this time were missing from. We had 1 youth missing from Scottsbluff County, 1 youth missing from Saline County, 6 youth missing from Lancaster County. In our Eastern Service Area, which is Douglas and Sarpy County, we had 30 youth missing. 4 youth missing from Thurston County and 1 youth missing from Dakota County. In Nebraska, we do have resources to help victims or survivors of human trafficking situations. We have our child advocacy centers across Nebraska, and they are a partner with the department if there has been instances of trafficking. They are able and have the staff that have been specially trained to do forensic interviewing. The Salvation Army also has a safety program. This program can help with many different things when it comes to survivors and victims of trafficking situations. They have trafficking specialists across the state that can be contacted for help in finding different resources for victims. The Indigo program is a program of the Women's Center for Advancement partnering with Youth Emergency Services in Omaha. They provide direct services to victims of sex trafficking between the ages of 17 and 24 years old in the Omaha and surrounding area. Another resource is through the National Center for Missing and Exploited Children. Team Hope. It's a peer group that provides emotional support to families who have had missing, recovered, or exploited children. Team Hope is a group of ordinary people who one day were forced to live every parent's nightmare. They know the pain, fear, frustration, and loneliness that comes with having a missing or sexually exploited child. With this knowledge and experience, they offer peer support to families of missing and sexually exploited children. Other resources that are available: the Polaris Project, National Children's Advocacy Center, the National Center for Missing and Exploited Children, Shared Hope International, and NetSmarts. We're in this together, and it's on us. The Nebraska Human Trafficking Task Force was created in 2015. Its creative solutions to address trafficking through joint law enforcement and service provision. A $1.5 million grant to combat trafficking was given to the Attorney General's Office and the Salvation Army Safety Program. Through this, we have been able to create service development. It's a partnership with the Department of Health and Human Services, Children and Family Services Administration, the Safety Program Trafficking Specialist, the Nebraska Alliance of Child Advocacy Centers, and the Nebraska Coalition to End Sexual and Domestic Violence, along with the Office of Probation Administration, Juvenile Services Division, and you, our foster parents. You are part of this group. We need to make sure that our systems are working together for our youth. It's so important that we support them.